2NURFM, a broadcast service of the University of Newcastle.
Great to have in from the University of Newcastle. Jess Ferguson has popped into the studio. Before we have a chat about your exciting study and what you need, Jess, what did you want to do when you were just knee-high to a grasshopper as far as a career is concerned?
I really wanted to be a vet. I loved animals. We grew up with so many different animals at home, but then I think I realised I loved them too much that I wouldn't be able to put them down or operate on them, so I kind of gave that dream away. But I did always want to be a vet.
Well, first and foremost, that is a very, very, very respected profession.
Good.
So you had to, and you're still in the good books. I couldn't do it either. I'd be a terrible vet because someone would come in with an injured animal and I just burst into tears and run out of the room.
Exactly, or want to cuddle it.
Where's the vet gone? Oh, he's out the back crying. Oh, not again. All right, getting back to what you have popped in the studio. Research aims to reduce blood cholesterol levels and other risk factors for heart disease. You know, it's interesting. It seems over the last couple of years, heart disease, whilst it's still a major factor, it kind of feels like it's dropped off the radar a little bit. Are you feeling that?
Yeah. I mean, the thing with heart disease is that it is the leading cause of death worldwide. So it's still a very prevalent problem. But the thing is that it's so widespread that it sort of flows on to lots of other conditions. Like you got diabetes, obesity, and all those pre-diabetic conditions as well. They kind of are subsequent consequences of heart disease or can actually lead to heart disease. So it's all sort of a multifaceted problem, I guess. So, yeah. Yeah,
because when we think about diabetes now, sugar is the thing that generally just gets thrown around. Sugar is the new evil at the moment. Yeah. So what are you trying to do? What's the study? What's the research? And who do you need?
So what I'm trying to do is reduce the two major risk factors for heart disease. So that is we've got high cholesterol, which a lot of people are quite aware of as being something associated with heart disease. But it is just one side of the story. So the other side of the story is chronic low-grade inflammation. And I'm not just talking about the inflammation you get when you hurt yourself or you injure yourself. It's actually that chronic low-grade sustained inflammation that's silent in the body, and it actually is causing damage over a long period of time to arteries and causing, more pro-inflammatory states in the body.
Margarine and an Indian spice are being enlisted. I always thought margarine was just the devil's spread these days.
Yep. We get a lot of those kind of comments and queries from people. So, yes, in Australia, the margarine processing does not lead to those trans fats that a lot of people think we have in our margarine spreads today. But our margarines, the ones that we're using in the study, are based on your vegetable oils. So they've got a lot of those good, healthy mono and polyunsaturated fats. But what we're actually more interested in is plant sterols. So these are what are actually fortified into these staple foods like your margarine spreads or some milks. And your plant sterols are found in all of your plant-based foods like nuts, seeds and oils. And then the Indian spice comes in to tackle that inflammation. So that actually helps to lower inflammation. And what we're interested in is actually the curcumin, which is extracted from the turmeric, which is that common Indian spice that people have heard of.
Okay, so who are you looking for? Who can be a part of your research?
Yes, so we really need adults aged 18 to 70 years old who may know that they've got high cholesterol, so that's cholesterol at 5 or more, but they're not on medication for their cholesterol. So we need them to call me up on 4921 5636. I'll just repeat that again. That's 4921 5636, and express your interest in the study, and we can talk about whether they can participate.
You're looking for adults, so anyone over the age of 18. You'd kind of hope that there weren't too many 18-year-olds that had high cholesterol, wouldn't you?
Yes, you would hope, but yes, we have had a few that are in their early 20s and 30s. So, anybody over that age is welcome, and they just need to come into the University of Newcastle and participate in a 4-week trial.
Fantastic. Jess, thanks very much for your time this morning.
Thanks so much.
And I think you would have made a great vet as well, but I totally understand why that didn't happen. And if you want to catch the numbers or how you can get in touch with Jess regarding that research, it'll be on 2NURFM.com. Just head to the morning page. All the details will be there for you.